like to talk about overcoming barriers to care in Alzheimer's disease. I'm Dr. Diana Kerwin. I'm an internist and geriatrician. I've been working in the field of Alzheimer's disease diagnosis and management for 20 years. The projected number of Alzheimer's disease cases are really increasing rapidly. And we think by 2050, actually in the United States, we're going to be up to over 13 million cases. And as we know, this is all reaching all communities, whether they be urban or rural. And also many countries outside of the United States are looking for better ways for the healthcare community to be able to take care of, reach these patients, diagnose and treat them. One of the issues that we're seeing with Alzheimer's, or one of the main barriers, is really access to care. And the reason why access to care becomes an issue is it starts to really build up or delay or prolong the timeline to getting to the right specialist, to getting to the right diagnostics, and then getting to the right treatment. So for the first part, when you think about it, although many primary care physicians are really where we put our first line for the recognition of memory loss and Alzheimer's disease, there does tend to be a lot of burdens placed on primary care with other disease states that they're managing. So one of the biggest barriers that we're seeing initially is just the access to a dementia specialist that feels comfortable with the guidelines of how to make the diagnosis, and then basically how to outline a treatment plan. Once you get to the diagnosis, which sometimes can take several years to get to the correct one, then it's outlining what is really part of that diagnostic is what is access to the most up-to-date diagnostic guidelines. So now that we're heading more into biomarker-based diagnosis of Alzheimer's disease, what is the access to amyloid PET scanning or other more advanced biomarker? What is the access to plasma-based biomarkers as well? And then once we have that biomarker capacity, what's the timeline to getting to the appropriate treatments now that we're starting to see some approvals of some disease-modifying therapies? One of the questions about who is the right specialist. So right now we do consider usually neurologists who are specializing in cognition, geriatricians and geriatric psychiatrists to be one of the dementia specialists that healthcare or primary care providers would reach out to in order to help them make the diagnosis of Alzheimer's disease. So when we look at our workforce, we know that we've been seeing increases in primary care practitioners in the community. But when we look at our dementia care specialists, we're actually starting to see some of those numbers initially go up, but some of them come back down again. For neurologists, we are projected to see more neurologists, but again, only talking about 17,000 going up to 19,000 in the United States. We're actually going to see an initial increase in geriatricians that then will come back down. And the sad part is for geriatric psychiatrists, we're actually going to see that number go down over the next few years. So some of the thoughts that we can think about for improving our healthcare disparities. And one that I would add to this is with healthcare disparities, really it's access. As we're looking to increase our access, can we make sure that we're increasing our access to all communities, both rural and urban, also looking at underrepresented minority communities throughout the United States to be sure that as we start to address the barriers, that we really try to provide solutions for every patient that's being affected, not just the ones that are located in certain areas or near certain centers. So one of the ways that we could likely address some of these healthcare disparities is really improved education and training to primary care physicians. They really are our first line of defense in identifying patients, helping patients navigate through the dementia diagnostic guidelines or domestic diagnostic process, but also so that they can stay on top of what the most up-to-date guidelines are, as we know that the field of biomarkers has been changing significantly. So we want to be able to get them real-time information as well. Another piece is potentially the use of telemedicine. How do we increase our reach of our dementia care specialists to areas that are more difficult to reach? Again, more urban areas, even though there tends to be more medical centers, there can still be areas that are not being reached by the medical community. And definitely in rural areas, we know that there's oftentimes a paucity of hospitals, primary care, and definitely dementia specialists available. So how do we begin to increase that reach, potentially by adding satellites or telemedicine clinics? That has been piloted at other centers.